to you all, and I'm delighted to be able to join you at this great conference. What a positive way to start the new year of 2022. I'm Mary Renfrew. I'm Professor Emeritus at the University of Dundee in Scotland, and that just means I'm formally retired. And I'm talking to you today from the lovely southwest of Scotland in Galloway. And I want to say hello to each and every one of you, wherever you are, whether you're in Ireland, whether you're in the UK or countries right around the world. And I'd like to say a special hello to any students who are able to join us today, and indeed any midwives who've qualified over the last 2 years and learned your profession during this really challenging time. So hello to you all. So here we are. I'm going to talk about the power of midwifery. Its astonishing power to transform outcomes and experiences for women and newborn infants right across the world. I'm going to do a bit of context and background to midwifery and maternity care in 2022. I'm going to summarise the evidence, the astounding power of midwives. Some of you will know this, of course, but it's really important to revisit this and to consider quite what the messages are that it's telling us. And I'm then going to talk a little bit at the end about the action we need from midwives and using this evidence to make a difference. So what is the context of midwifery and maternity care in 2022? Well, here are some of the challenges that people are facing, whether it's women, babies and families, facing the high rates of maternal and newborn mortality that still exist across the world, mostly in low-income countries, but still there are challenges for all of us around preventing mortality, around preventing miscarriage, stillbirth, preterm births, and mental health problems for women and for babies and families. There are ongoing low rates of breastfeeding right across the world. We're seeing increasing awareness of inequality and poverty and racism, which blight the care that we are able to give and the experiences and outcomes for women and babies. And we're seeing limited respectful care and women's decision-making in countries right across the world. The challenges for staff in the system are, of course, long-standing staffing shortages and workload pressures in many, many countries. And that builds alongside inconsistent standards and the role and scope of midwives, where some countries don't even have midwives. In others, midwives have very limited scope. And even in countries where midwives are trained to high standards and educated to provide the full scope of midwifery, their role and scope can be constrained. There are concerns about safety for women and babies and inconsistent quality from place to place and from women's own backgrounds and the inequalities that can relate to that. There's increasing rates of interventions. Now, this is becoming a real problem in many, many, many countries. And in the UK at the moment, we have the highest rates of cesarean section that we have ever seen. And we have rates of induction that are approaching the epidemic of inductions that we had when I became a midwife back in the 1970s. It's quite an extraordinary set of developments that really need our attention. We have very slow implementation of evidence-based midwifery with some of our key practices, continuity of care, for example, that we know will make a big difference, really not picking up speed in the way that we would want. And extraordinarily, we have contentious dialogues around safety and normality that really are being headlined in the media and also taking up a lot of discourse in professional and multidisciplinary forums. Cutting through this in a really acute way, we have COVID-19 having a direct impact on women, babies, families, and indeed on staff and systems and societies and whole populations. And I don't need to tell you about that. You are working with that every day, and the impact is huge and continuing for the moment. And although it's different in country to country and different contexts, it really is something that is affecting everybody right across the world and hugely impacting on midwifery and on midwives. I wanted, though, to be a little bit positive about that message. And I don't know if any of you have read this wonderful book by Emma Donoghue called The Pool of the Stars. And it's set in Dublin in the last flu pandemic, the great flu pandemic between 2018 and 2020. And it's the story of a midwife working during those times in a hospital in Dublin. Now, one of the things that she wrote in this book was that the midwife who was learning to deal with the pandemic at that time said, "We will never learn more or faster." And I think if you think about the learning that you have had over the last couple of years since COVID first entered our lives, I think you'll see that actually we adapt, we learn, we take in information, we absorb, and we move forward. And the extraordinary adaptation that everyone has gone through in the last 2 years, we've learned so much. But just think about the way midwifery and maternity services have adapted and tried to do positive development to really, really work with women, with families, with babies, to keep them safe, but also to give them the best quality care, and also how to continue on with good quality education for our new students, for our new midwives. It is extraordinary that there has been such rapid adaptation and learning, and I think all of you should feel incredibly proud of that. There's also lots of positives to think about in midwifery and maternity care. I've given you a list of the challenges. Here are some of the positives. There is increasing recognition from the global community of the contribution of midwives, and I'm coming back to that later. We've got reports like the State of the World's Midwifery and the Framework for Action for Strengthening Quality Midwifery Education, all coming out of global agencies, absolutely recognising the importance. We have evidence coming out, for example, from the Cochrane collaboration, Cochrane Ireland particularly, and from the Lancet on the importance of midwifery. We have great policy from different countries. I've put up here Scotland's Best Start and England's Better Births. It's coming through in country after country, recognising the importance of midwifery. We've got the new standards of proficiency for midwives from the NMC in the UK. We've also got building great leadership. I've put up here a Zoom picture from the English Chief Midwifery Officer and her team building strength in midwifery leadership. And that is happening in country after country. It's fantastic. The biggest strength, of course, for midwifery and maternity care is midwives themselves, and the strength that midwives bring, the resilience, their fantastic ability to find solutions to intractable problems is fantastic. Coming now to the evidence on the astounding power of midwives. I was privileged in 2014 to be the principal investigator and co-lead for the Lancet series on midwifery. And what we were asked to do was evidence the impact of midwifery. And when we sat down to think, well, how do we do this? One of the challenges was to think about, well, what is midwifery? It tends to vary from country to country. And of course, it varies from study to study that might be providing the evidence for midwifery. And we worked on working out solutions to that particular methodological problem. We developed a new way of seeing the evidence. We collated the evidence in a different way than had been done before. We wanted to put, as all midwives do, women, babies and families in the middle of the page and build the evidence around them. So focusing on them, we looked at the care that is across the continuum, based in human rights for all women and babies, leaving no one behind. All the relevant outcomes, short-term, long-term, clinical, psychosocial, and so on, for all countries, low, middle, and high income, taking a long-term view of quality care and services, being careful to distinguish in the evidence between what is done, how it's done, and who's providing it, looking at an interdisciplinary cross-sectoral workforce and a diverse workforce, but looking particularly at the specific contribution of midwives, looking at a diverse set of evidence and building evidence-informed consensus on what midwifery can achieve. I'm not going to stop too long on this slide. I just want you to see that underpinning what I'm going to tell you about the astounding power of midwives is a huge amount of evidence from hundreds of systematic reviews, from thousands of studies, all work through that particular set of principles that I have outlined for you there that we set. And building all this evidence together from all these different kinds of studies, we've looked at what midwifery is, how it's provided, who provided it, and its impact. We developed a definition, so we had a stable framework for our evidence and that we could tell people what we were talking about. This evidence maps very closely onto the international standards. I'll come back to that in a minute. But basically what we're talking about is this full scope of midwifery, skilled, knowledgeable, and compassionate care for childbearing women, newborn infants, and families across the continuum from pre-pregnancy, pregnancy, birth, postpartum, in the early weeks of life. And of course, then there are the core characteristics of that, which includes optimizing normal biological, psychological, social, and cultural processes of reproduction and early life, including prevention and management, consultation with and referral to other services, respecting women's individual circumstances and views, and working in partnership with women to strengthen women's own capabilities to care for themselves and their families. We then went on to develop the quality maternal and newborn care framework, which pulled apart the evidence and then, if you like, put it back together again in an easy to access way to show what women need, how they need it, and who they need it from. This framework is called the QMNC. You may have come across it before, published in the first paper of the Lancet series on midwifery. And briefly, I'm just going to talk you through today, but behind each of these components of the framework sit, as I said, hundreds of different pieces of evidence. What you'll see down the left-hand side is different topic areas for each of these components. Along the top, for practice categories, we've got the green components, which are for all childbearing women and infants. Everybody needs education, information, health promotion. Everybody needs assessment, screening, and care planning. Everybody needs promotion of normal processes and prevention of complications. Some women also need, as well as that, first-line management of complications and medical obstetric and neonatal services. Fewer women should need that if we have those green categories in place for everyone. The organisation of care for all, based on a human rights framework of available, accessible, acceptable, good quality services for all, with adequate resources and a competent workforce. Continuity and services integrated across community and facilities. That is not enough on its own, though. We need all of that to be grounded in the values of respect and communication, community knowledge and understanding, and care that's tailored to women's circumstances and needs, and the philosophy of optimizing normal processes, strengthening women's own capabilities, using interventions only when indicated, and care providers who combine clinical knowledge and skills with interpersonal and cultural competence, and the division of roles and responsibilities based on need, competencies, and resources. Add all that together, and that is what all women, all babies everywhere need. Now you can then map onto that the midwifery competencies, and we've mapped onto that the what midwives can provide who meet the ICM international competencies, the full scope of midwifery as defined by the ICM, shown within that blue line. And it's, as you can see, it goes all the way round that framework. There's a bit of a dotted line in here because there's quite a lot of crossover, disciplinary crossover happens in here. We didn't want to have a too hard and fast line on that. And so international standards can provide all that amount of care for women and babies. So that is what the evidence told us. We then wanted to see that if that standard of care was provided, what would the impact of midwifery be? And so we thought about it in this way of survival, of surviving, thriving, and transforming, as the global strategy says. And what we found was an astonishing set of outcomes. Mortality reduced, harm to women and newborns reduced, improved psychosocial outcomes, intervention use reduced, and improved public health, and improved health service outcomes, which of course feeds through to reduce costs for the health service. So maternal mortality, neonatal mortality, stillbirth, infant mortality, and miscarriage all reduced. Reduced maternal serious morbidity, including infections, anemia, eclampsia, and postpartum hemorrhage. Reduced newborn outcomes, including preterm birth, low birth weight, hypothermia, is small for gestational age, and infections. Improved psychosocial outcomes, which includes satisfaction with childbirth, mother-baby interaction, and reduced anxiety and postpartum depression and newborn crying. Intervention use reduced with increased spontaneous vaginal birth and reduced a number of interventions. Improved public health outcomes includes breastfeeding initiation and duration, improved birth spacing, increased immunization, reduced smoking. And for the health service, increased referrals, increased attendance in labour by a known midwife, reduced stay on labour ward and hospital stay for newborn. All of those 56 outcomes improved by international standard midwifery. It is astonishing. There is no other intervention that has this breadth and depth of impact on outcomes and on women's experiences. If we then go on to look specifically at midwife-led continuity of care and the Cochrane review led by Jane Sandel on provision of care on experience and outcomes, we start to see again in there the scale of the improvement in outcomes. 24% less likely to experience preterm birth. That's astonishing. There is no other intervention that comes close. And women's experience hugely improved by continuity of care. The evidence is very, very strong. The quality of evidence in this review and the other relevant Cochrane reviews is tremendous. The impact of midwifery on mortality I wanted to focus on particularly because it's an outcome that is at the core of thinking about safety. And it's a key global challenge as well as a challenge for each individual country. And this paper published in 2021 really brought absolutely up to date in more detail some of the work done in the Lancet series on midwifery, which looked at the potential impact of midwives in preventing and reducing maternal and neonatal mortality and stillbirths. And what they found was that universal coverage of midwife-delivered interventions could avert 2/3 of maternal and neonatal deaths and stillbirths. There is no other intervention that comes close to that. What they said, and this is a report by UNFPA, WHO, and the International Confederation of Midwives, said that increasing access to competent and regulated midwives could save millions of lives each year. It improves positive birth experiences, health outcomes, workforce supply, inclusive and equitable growth, economic stabilization, and a positive macroeconomic impact on whole populations and societies, not only on individual women and babies. So that was absolutely out there and in that report. So that is the astounding power of midwives. And I just want to pause for a moment and reflect on that, because until this work was done, although we had an idea that that was the case from individual studies, the pulling of this evidence all together, we actually really didn't know, but we do now. We do now, and we have this evidence that we can think for ourselves, that we can teach our students, but that we can use as a tool to make a difference, whether that's working at local level, whether that's working at national level in your own countries, whether that's working globally to strengthen midwifery. Action for midwives is now a global and national priority, and scaling up care by midwives must now be a global priority. And we are seeing more and more information about this out there. Just to pause for a moment about what might be holding midwifery back, because we know that midwifery is not being strengthened in the way that it could and should be. Decision makers need to know what midwives can contribute for various reasons. A lot of them actually don't. The slow implementation of evidence-based midwifery and the full scope of practice and model of care. There's a whole lot of reasons behind that. One is an over-medicalized model of care that has, if you like, dominance within a system. And so there is lack of power in the system. And there's a great study published by Philby and McConville looking at barriers to midwifery and the implementation of midwifery globally, that you might want to look at, very much about the lack of power in the system. Midwives can provide about 90% of the care needed, but they currently account for less than 10% of the global workforce. And State of the World Midwifery 2021 calculated that the world needs almost 1 million more midwives than it currently has. So that is our real challenge. However, the power of evidence is working. It's changing hearts and minds. This is Dr. Tedros, who's Director General of the World Health Organization, who said, as a result of the evidence that we've been talking about today, midwives are at the heart of universal health coverage and primary health care. And when you map the impact of midwifery against the Sustainable Development Goals, for example, you see that midwives and international standard midwifery can impact probably 12 or 13 of the different Sustainable Development Goals. It's motivating policy shift. India, which had not had professional midwives, decided in 2018 that it was going to implement professional midwives across its country, and brought in guidelines on midwifery services in India. It's been a huge amount of work by a lot of people, but right up in the first paragraph of this document is the evidence I've just shown you and the impact that has had on the thinking of the key senior decision makers in India. It can motivate policy shift. It can actually shape policy and practice. This is the best start. The 5-year plan for maternity and neonatal care in Scotland, which has been hugely shaped by the evidence I've just shown you. These WHO documents, the Global Strategy on Human Resources for Health, Global Strategic Directions for Strengthening Nursing and Midwifery, again, hugely informed by the evidence I've just shown you. It can shape research and analysis. These are a couple of examples of papers that have used the evidence, that have used that framework to study women's experiences, to study the impact of different models of care, and to study ways of educating students. So it can really help to shape research and analysis. It can strengthen collaboration and action. This framework for action, strengthening quality midwifery education for universal health coverage 2030, produced by WHO, UNFPA, ICM and UNICEF, is all underpinned by the evidence that we've been talking about today. The new UK standards of proficiency for midwives, the NMC standards now being rolled out right across the country, all universities, all students, and indeed all midwives, absolutely founded on the evidence I've shown you today. How can this evidence help you? There's all sorts of ways in which individuals and organizations can use this evidence once people are aware of the power of midwifery and how it works. So, for example, people can do a gap analysis, you know, wherever you're living, whatever your context, whatever your local circumstances, you can look at your policy, you can look at your practice, map it against the framework and see, are you actually providing, are you able to provide the care that women and babies need? And where are the gaps? You know, is continuity of care missing? Is respectful care missing? Is the optimizing of normal processes missing? You know, what's there and what needs to be strengthened? And that can then help to build strategy, to build policy, to build planning, and to inform collaborative action. It can help to identify research priorities. You can actually map against this framework and build on the evidence that exists to say, where are the gaps? What are our priorities for future research? It can help to inform and build education and standards, and can be used, as I said, to identify gaps, but then to fill those gaps and to fill them with confidence, because it's quite difficult to stand up against a system that actually is built from different parameters sometimes and say, this form of care is incredibly important. This form of care really works. Look what would happen if we all work together to implement international standard midwifery in the context in which we're working. And it can inform messaging and communication. You can be clear and confident that what you do, the midwifery care that you provide, really works, and really works for women, for babies, for families in all countries. It's an incredibly helpful tool for sustaining and strengthening global midwifery, but also midwifery nationally and midwifery locally, to work to improve outcomes and experiences for women and babies. And midwives are not alone. There is now a growing awareness globally of the importance of midwives, the need to strengthen midwives. There's growing evidence, and evidence is being added all the time to strengthen what we already know. And there's support and there's guidelines internationally and nationally. And of course, the amazing support that midwives have for each other has always been really, really strong. So I'd like to thank you all for listening today. I think, you know, it is such an important job to be doing, especially at this really, really critical time. And I'm looking forward to life, I hope, improving in 2022 as we learn how to deal with COVID and we learn how to really continue to work with women and babies and provide the best possible care at all times. So I wish you all well for the rest of the day, and thank you very much for listening to me. Thank you. Bye-bye.